Yeah, thanks for giving me the opportunity to share this with you. Today we're going to talk a little bit about nutrition and health, and kind of really where the food that you grow actually is what contributes to health. And we're talking about real food, right? And food as medicine, which is an ancient concept that's been around for thousands of years across the globe. So I'm at the University of Arizona, the College of Medicine Phoenix, and we have a culinary medicine program, which I'll talk to you a little bit about, which is a partnership with the School of Nutritional Sciences and Wellness and Arizona Cooperative Extension. It's a statewide initiative that we have with a number of different projects engaging health professional students and communities. Let me see if the clicker's not working. Yeah, neither arrow is working. So let's see. Let me see if we have to turn it on. I think, yeah, let's turn it on. There we go. Okay, so as I mentioned, this concept of food as medicine has been around for thousands of years. You may have heard the quote from Hippocrates, "Let food be thy medicine, medicine be thy food." There's another quote actually from the Indian subcontinent and from traditional Ayurvedic medicine: "When diet is wrong, medicine is of no use. When diet is correct, medicine is of no need." And so this concept really is really part of many cultures, including indigenous cultures, but also food traditions that people grow up with. As an immigrant to the United States, I had a lot of this as part of my own folk remedies with my parents, and different kind of traditional remedies from kind of old Persian medicine, which is very similar to Ayurveda and traditional Chinese medicine, talking a lot about balancing properties of different foods, like how foods have cold nature and warm nature, like cucumbers being cooling, watermelon being cooling, honeydew melon and cantaloupe being warming, grapes being warming. There's all sorts of classifications, but these concepts have been around for a long time. And it is not until recently where we started to make connections between this and the diseases of our time. But before that, I just wanted to point out what we really do in medicine. One of my mentors told me that, there's really three things that we do in medicine that we can do as physicians. Is we can medicate, we can manipulate or use some kind of surgery or intervention, right? Or we can educate. Unfortunately, most of us are really trained to focus on, you can come on in, welcome. Most of us are trained to focus on medication and surgery, right? With very little on the education part, right? Actually, the root of the word to doctor actually comes from the Latin to draw out, to educate, actually, which is actually something that we don't do enough of, I think, and especially when we look at the diseases of our time. And so, the dynamic at play with our healthcare system is that we don't really have a healthcare system, right? We have a sick care system. We have a reactive disease management system where we wait until people get sick, and then we try to put a Band-Aid on them and send them out back into the world, to kind of have a half healthy life, right? And they keep coming back in for medications, right? In fact, 2/3 of every doctor's visit in the United States actually results in a prescription medication. 60% of Americans actually are on at least one prescription drug. And I'm not to say that medications aren't useful and don't have a role, because they can actually be life-saving and very critical, but they don't come without side effects, right? Some statistics have medications and adverse reactions to these medications as high as the 4th leading cause of death. So the question comes up, is there something other than medication that we can use, right? And surgery obviously goes without saying. Every surgery is a life-threatening potential situation where there's bleeding risk, infection risk, and so on. Again, can be really critical in those acute situations, but not so helpful when we look at chronic disease, right? And that's really, we're going to talk more about that, but we're very good at kind of stabilizing someone in that acute setting, but we're not learning a lot about how to keep people healthy in the first place. And I think that's where we can look to other approaches. And, again, just to kind of point out how this approach that we have, the acute care model, as I call it, in medicine, is really over 100 years old. And it came back at the turn of the 19th century, when we actually had, in the early 1900s, acute infectious disease was the most common condition that most people were suffering and dying from, right? These were the conditions like typhoid fever, tuberculosis, right? But when you fast forward, 100 years later, you don't have as many acute infectious diseases, you have more chronic diseases. In fact, globally, the World Health Organization has noted in the last 20 years that over 60% or more of global deaths are due to chronic diseases. Cardiovascular disease or heart disease, diabetes, cancer, as well as non-communicable lung diseases like asthma or COPD, right, that are a result of environmental exposures and allergens, right, in our food as well as in our environment. So when we look at these, chronic conditions, the approach that we have about acute care, is not really the best approach, right? You can't catch a heart attack like you catch a cold, right? A heart attack or a stroke is the end result of decades of a process of hardening of our arteries, narrowing of our arteries, right? Maybe from uncontrolled high blood pressure, and eventually you're going to get that chronic inflammation leading to narrowing, which basically gets into that acute event. And we're very good in that moment of that acute event to try to save your life. But what about all those opportunities well before that even happens? Because that's an acute exacerbation of a chronic condition, right? How about actually intervening well before that to prevent that from happening in the first place, right? Is there a role for something other than just medication or surgery, right? We can modify risk factors to a certain extent, but is there something else that we could do? And again, chronic disease affects 6 out of 10 adults. So this is really the disease of our time. It's the lead, these are the major diseases. It's not a real mystery what people are suffering and dying from. And chances are any of you in this room either have one of these chronic conditions or a risk factor for them, or know a family member or friend who does, right? Because it's the most common thing out there. What's interesting is that the US spends around $1.1 trillion per year to treat these chronic conditions, which is actually equal to all the money Americans pay for food, and an alarming burden on individuals in the healthcare system. So what is the food that they're paying for? So we'll talk a little bit more about what that is, and how that impacts health outcomes and the connection between our food and health. Again, 7 out of every 10 deaths, 77% of all costs basically really boil down to cardiovascular disease, diabetes, and cancer, and obesity is a big comorbidity with that. So is there a connection between diet and nutrition and the diseases of our time? Obviously, it's a very important question to ask. So let's look at some of these major diseases and see what the connection may be. What about diet and cancer? So we know the American Cancer Society confirms that poor diet can increase the risk for a number of cancers: lung, esophageal, stomach, colorectal, and prostate cancer. The WHO estimates anywhere about 30% of all cancer cases are connected directly to diet. That percentage goes up to over 70% when we're looking at cancers of the gastrointestinal tract, like colon cancer, gastric cancer, esophageal cancer, right? More recently, we have data that actually shows a strong association between processed food consumption and increased risk of cancer. One study showed that a 10% increase in the consumption of processed food was connected directly with a 10% increased risk for breast and prostate cancer. Cancers that we didn't understand in terms of what caused them, aggressive ones like ovarian cancer in women, now we're starting to see very strong associations with processed food consumption. So very, very interesting to kind of learn more about kind of that direction with cancer. And we're seeing that connection. So there's definitely a connection there. How about diabetes? Well, this is what I would call a slam dunk. 95% of all diabetes is type 2 diabetes, right? So there's two types. Type 1 is the kind where your pancreas doesn't produce enough insulin anymore, right? So you basically have high blood sugar, and insulin is the hormone that basically prompts the cells to pull the sugar out of the bloodstream into your cells, right? So that's about only 5 to 10% of all diabetes. 95% of diabetes, which affects, around 12% of the American population now, is basically type 2 diabetes, which is caused by insulin resistance. Insulin resistance is something that happens over time. So you can think about it as, your sensitivity to insulin basically goes down. You still have, your pancreas is pumping out all the insulin it can pump out, but your body's not responding to it anymore. And the reason for it is you can think about like a shock absorbers, right? Like if you're on an ATV or in a car, like you keep hitting those potholes over and over again, eventually your shocks will be worn out and they're not going to work anymore. And the same thing happens when we keep pumping out, all of these high levels of blood sugar, right? A lot of times with unfortunately, the processed foods that we eat, which are loaded with a lot of refined sugar, which without the fiber that comes from real food, right? The food that grows from the ground that tends to be high in fructose also tends to be high in fiber, right? And what happens is the fiber, gram for gram, cancels out the impact that sugar can have on your blood sugar levels. The reason is that it's connected and it slows down the absorption. So you're not getting a big bump in blood sugar, you're getting a gradual release, right? This is a difference between whole grains versus refined grains, right? In terms of the impact, this is the difference between whole fruit versus juice, right? Because the fiber is actually the key. And it's very interesting that in nature, the foods that are the most sweet, the fruits that are the most sweet, like dates, for example, are very fibrous. And that's actually very interesting because it actually has a protective impact on human health. Fiber, by the way, is also the main food of the microbiome, right? So we're learning now that we're 90% bacteria and only 10% human. There's more bacterial cells in us than human cells. And the main food of these bacteria is actually fiber. But how much fiber do we get now, right? Over 100 years ago, we ate more food that was unrefined coming directly out of the ground. We had that relationship, between the farms and agriculture and health that we don't have anymore, especially with big agribusiness and the way things have kind of gone with the food industry, which we'll talk a little bit about. And now we get, before we would get an average of 35 or 40 grams of fiber or more per day. Now it's more like 7 to 9 grams of fiber per day, right? And that's decimated the diversity of our microbiome. And we know that the more narrow the diversity of the microbiome, the higher the propensity for, guess what? Diabetes, obesity, heart disease, cancer. So all those are also connected together as well. And now we're seeing those kind of associations come full circle. That alone, I think, is a very compelling reason why we have to eat more food that comes out of the ground, because of the fiber and the impact it has in so many areas of our health. What about food and cardiovascular disease? Well, fiber is actually one of the things that actually reduces the risk of heart disease too. There's an inverse relationship. As you eat more fiber, you have a lower risk of heart attacks and strokes. It's like that's a direct association. That's because fiber lowers blood pressure, which is a key risk factor for heart disease, right? And it also lowers LDL, or bad cholesterol, by binding to it, actually, the gut, so you're not actually absorbing all of it. So that's another benefit of fiber. So cardiovascular disease, is there a connection with food? Absolutely, with not only fiber, but we know that upwards of nearly 50% of all deaths related to heart disease are directly linked to diet. A lack of this, plant foods, and specifically insufficient nuts and seeds, which are the healthy fats that you actually need for a healthy heart, as well as the omega-3 fish, foods, and too much processed meats. So one of the things that contributes to heart disease is high blood pressure. And in our, processed food diets that we eat, the three major contributors of excess sodium that contributes to blood pressure are pizza, deli meats, and potato chips. So all three of these, and I know they're favorites of a lot of people, they're just loaded with way too much sodium, right? Which connects with this, right? And again, these are refined. Deli meats have a whole other category too, because deli meats on their own have been deemed to be carcinogenic for colon cancer, basically causing increased risk of that. And they're actually classified as a carcinogen by the World Health Organization. So there's definitely a connection here as well in terms of diet and the disease over time. In fact, there was a study where they looked at dietary risk and all sorts of risk across 195 countries, nearly 30 years. And they actually found that suboptimal diet was responsible for more deaths than any other risk globally, including tobacco smoking. So number one contributor is diet. Poor diets in the United States really are number one, in terms of contribution. When we look at the health of America, some estimates have us as only 12% to be metabolically healthy. What that means is that We don't have any of the elements of metabolic syndrome, which are basically high blood pressure, pre-diabetes, which by the way, over 90 million of us have pre-diabetes. And of that 90 million, 60 million don't know that you're pre-diabetic, which is another reason which is important to do screenings and have good primary care, right? To know kind of what your numbers are. High triglycerides, which come from excess simple carbs and sugars in our diet. Low HDL, which is a lack of the healthy fats, which is a protective good cholesterol, and also lack of physical activity, right? The one thing that can raise your HDL actually is cardio exercise, aerobic exercise. And the fifth one is abdominal fat or waist circumference, specifically at the belly button, which is actually the worst fat to have. That's the fat that is the metabolically most active, that's associated with worsening, premature disease and death. And, a lot of times, actually, we probably should be doing waist circumference instead of BMI, because when you look at BMI, who I would argue is the greatest basketball player who ever played was Michael Jordan. We can talk about that later for those who have a different opinion. But at the height of his career, he was in the overweight category by BMI standards. His BMI was like 27. But that's just because BMI doesn't take into account, right, your abdominal fat, your visceral fat, which is actually the one that's most pathological, right? It looks more just at height. And if you have, great muscle density and mass like Jordan had in his prime, like you may be in the overweight category, but it's inaccurate, right? So I think that's also something to think about. And just a word about fat, I think just as an editorial here is, which is important, is that, low fat was the thing, and a lot of food companies still, say we should have low fat foods, and they have low fat products. And that's because for many years we thought that fat was the cause of heart disease. We now know that you actually need healthy fat for a healthy heart and also a healthy brain. And actually a lack of that healthy fat can contribute to those diseases. But what would happen is that we replaced a lot of the fat in these low-fat products with sugar. And then that contributed over time in the same decades that we saw this rise in diabetes and obesity, right? And so that's also led to these poor outcomes. So, in my practice as a physician, I have had the privilege of, really working with people who have these challenges, these chronic conditions, and really trying to shift the focus away from just medication and surgery to a whole person approach to care, where we actually look at food as medicine. And I've been able to see patients with type 2 diabetes, for example, who embrace a 80% plus plant-forward diet that's whole food based, that is not with processed foods, has plenty of healthy fats. And we see folks go from an uncontrolled state of diabetes with an average blood sugar of 300 or 400, with a hemoglobin A1C, for those of you who know what that is, of 10 or 11, to about 5 or 6 in 3 or 4 months without added medication. This stuff works, and it is really compelling, and it's very powerful to see it in action. And so I think, it's really important for us to recognize the connection between where our food comes from, how that food impacts our health, and how we collectively, including those of you in this room who are working in agriculture, right, can really make a case for all of us to, deeply dive into understanding where these things come from. And it's not only good for individual health, but also for planetary health. Unfortunately, not everyone has access to healthy food, and that's part of the problem, right? Somebody who is motivated and also has resources can do really well with the proper guidance, right, to be able to make those changes. But what if somebody doesn't have those resources, right? And I think that's part of the problem. We talk about food insecurity and how that was, expanded exponentially during the pandemic, and how we saw how many people were just really kind of teetering on the edge, and they fell off that edge. And that's something that, we really have to look at seriously, because there's a cycle, that comes with food insecurity, right? Where people have to make compromises when they are food insecure, when they don't know when that next meal is coming from. So they're going to maximize the calories that they get, right? And unfortunately, even participation in the Supplemental Nutrition Assistance Program is actually positively associated with both obesity and diabetes. And that's because the number one thing that's purchased, unfortunately, still, we have to reform the program, is soda. And so that's one of the things that we need to kind of look at. And that's because a lot of that's what's cheap and widely available. And when you have a choice, you don't know what your next meal is, you're going to have to maximize what you can to feed your family. And then what happens is, over time, that leads to chronic disease, right? Because you're making these poor choices. And so now not only are food insecure, but now you have diabetes. And now you have to pay for medications to treat your diabetes because you're not eating the foods that would have prevented it or can treat it, right? Because you're just on a budget and you're trying to figure it out. And then now you're not able to work as much. You have more missed days at work, and then suddenly you lose your job. And now you're even more food insecure, right? And so it's a vicious cycle that unfortunately millions of people in this country find themselves in. So when we talk about nutrition and health, we can't ignore the health equity lens when we look at these things and really try to address it from a food systems approach, right? Looking at local food systems, looking at national policies, and how they kind of set people up for failure in this way, which is really, really challenging. One of the things that we know that can make the most impact, again, going back to agriculture, right, is really the food that we eat. We know that whole vegetables and fruits, if we can shift to having more of those in our diet, we can make a huge impact in health outcomes. And we can see people becoming healthy, and it's a real win-win scenario there. Unfortunately, we have very poor whole vegetable and fruit consumption, right? Only 66% of Americans get 2 or more servings of whole fruit, and even less, 77%, eat 3 or more vegetables per day, right? And then when you have on top of that strange standards and rules in school systems, where they also do great work with the processed food industry, unfortunately, right? Where they have French fries and ketchup counting as 2 servings of vegetables per day. We're just shooting ourselves in the foot by basically setting up the next generation for failure, right? So these are all things that we have to look at, right? Some of the estimates of the Union of Concerned Scientists here kind of saying that if we even just ate 1 more serving of whole vegetable fruit per day, we could save 30,000 lives and $5 billion in medical costs. And if we actually just followed the guidelines, that number would even jump up higher. So, there's a lot, one of the practical steps, right, I think, is for people to just eat, whole vegetables and fruits, add that to their diet, right? Yeah, add that, and preferably, if we can, locally, to support local farms and local agriculture. When we look at our dietary, standards in terms of where we are, a little bit difficult to see this chart, but basically, this is kind of where the mark is, the line here, and then everything kind of above it is we're above, our intake is above recommendations, and the blue is we're well below that. So obviously we're well below, not surprising, on dark leafy vegetables, red or orange vegetables, beans, peas, lentils, all these things were well below it, right? Fruits, whole grains, total grains were maybe above, whole grains were way below, but then refined grains were way above. And that makes a huge difference, right? So, where you're getting that carb, whether it's in this complex whole grain with lots of fiber that feeds your microbiome, that doesn't raise your blood sugar, that lowers your cholesterol, lowers your blood pressure, makes a huge difference versus getting a refined grain without that fiber. Same here on the looking at meats and proteins and things like that. So this is what the standard American diet looks like, according to the USDA, which is SAD. Okay, that's a technical term, acronym here. It is SAD, right? And that's because, if you look at it, the little sliver of plant food, 12% is plant food. Okay, now, this could include plant food, right? The Impossible Burger is technically a plant food. French fries is technically a plant food, but we are actually categorizing both of those here because they're processed foods, right? So eating whole plant forward diet means eating whole plant forward, right? Not the processed version. And this is broken down even more because even of the plant foods here, about half of that are processed. So, this is a mixture of like protein, animal-based and plant-based, right? So we're talking about over 70% of the standard American diet is basically these processed food-like substances, or what I like to call frankenfoods. And all the elements of the standard American diet being high in refined sugars, high in excess sodium, high in animal protein and saturated fats, high in omega-6 polyunsaturated fats, high in processed foods, low in omega-3s, low in fiber, so low in the good stuff and high in the bad stuff. All these different elements have actually been directly associated with the chronic diseases of our time. So that's, very strong connection there. These are food-like substances, right? They look like food. They're supposed to, they're masquerading as food. We've been taught that they're food, but they're not really food. And I think that's one of the first pieces of advice I give every patient when I see them is start by eating real food and know the difference between a real food and a frankenfood, right? And most real food comes out of the ground, right? And even most meat is meat that eats food that comes out of ground, right? In a way that makes sense, like regenerative farming, for example. So again, lots of connections here between processed food consumption and the costs of it, right? The cheaper it is, that's also been associated with poor health outcomes in terms of obesity, and that makes a big difference in it. So I think the problem is that, you could say, this slide could say both broken food system and broken health system, right? They kind of go hand in hand, right? When our food policies are set up for failure, you're all obviously very well familiar with the Farm Bill. And the Farm Bill does a lot of good things with the Supplementary Nutrition Assistance Program, but it really is just a drop in the bucket in terms of looking at more sustainable forms of agriculture like crop rotation, organic farming, regenerative farming, right? Look more subsidies for whole vegetables and fruits, right? Most of it goes to these cash commodity crops, right? Like, corn, soy, and wheat. And unfortunately, those are the stuff of processed food, right? All of them have that. So soybean, let's take soybean oil and these seed oils, for example. A lot of them are heavily processed, with chemicals like hexane, high temperatures and high pressures. Oil is very delicate, actually, and very sensitive to temperature and pressure. When you you cause an oil to be hydrogenated, every fat basically has a carbon backbone with hydrogen atoms on it, right? So saturated fat means that all those carbons are saturated and connected to a hydrogen atom. So hydrogenated or partially hydrogenated oils, which you can see in most processed foods, okay, are created by doing high pressures and high temperatures, and then they use like a heavy metal as an alloy as part of it, and also chemicals like hexane to refine it further. What that does is it actually creates fat, trans fats. And it's really good for the food industry because when you look at a Twinkie, for example, with hydrogenated oils, it's more shelf stable. So it's gonna last for 6 months or a year or God knows how long, right? And so the customer can eat that product not only today, but a year from today, right? So those of us who are more connected with farming and agriculture, it's about how quickly you can get your stuff out there, right? Because things go bad, right? Can't have things sitting around. Real food goes bad, right? And there's unfortunately a lot of food waste, and there's a lot that needs to be done, and thankfully some organizations are starting to look at that. But processed food doesn't go bad. It's going to stay for a long period of time, and that's very intentional. Unfortunately, what happens with those hydrogenated oils, those processed foods, because of the trans fats that are formed, it actually reacts with the LDL, or bad cholesterol, in our blood, which actually causes and triggers actually that inflammatory response, which is what is the beginning of the cycle of inflammation that leads to plaque formation in our arteries. So it's actually directly linking us to heart disease. So, very, very, unfortunate, like in terms of the perverse incentives that are aligned in this way, making it very difficult for local farming, local agriculture, and more traditional agriculture, right? Approaches like, listening to the talk by Eamon about, pest management and kind of, crop rotations, right? And using, engaging our environment in a way that's commensurate, just like we do with our bacteria, right? We don't want to eliminate all pests because that's actually part of what's the dynamic of the ecosystem in which, the food is growing, right? You want to actually use them as an ally. You don't want them to get too far so they take out your crops. But at the same time, they're part of a complex web of interactions that actually contributes to soil health, right? Long-term sustainability for that soil, and also nutrient density in those foods, right? The studies, I have this slide later, but just since I mentioned it, studies show pretty clearly that, conventionally produced, mass-produced agriculture as compared to, more traditionally produced organic agriculture with free of the pesticides and the sprays, actually has a lower nutrient density than the organic. And one of the theories for this that I'm aware of is that the roots of every plant, right, survive based on what minerals they're taking in from the soil, right? So you have to make sure that the soil is rich in those minerals, right? In monoculture and kind of doing the same thing over and over again, you're going to erode your topsoil. You're not going to get those nutrients. But the other thing, when you're overly spraying with pesticides as well, on top of that, the plant is also not in a situation where they need to draw on the roots to get more nutrients from the soil, because a lot of their pathogens that are in the environment are completely eliminated. So it's almost like a hardiness factor. This is one of the theories, right? Where they go through that difficulty in terms of being able to grow and thrive, they're drawing more from the soil to be able to survive. But you're making it easier by just spraying pesticides, so they're not drawing as much nutrients from the soil. So I think it's a combination probably of soil depletion of minerals and that on top of it, which I think contributes to this fact, which I think is really interesting to think about. To me, it kind of makes sense. So, we talked about food insecurity, but I think what's really important is now we're starting to talk more about nutritional security, right? So it's not just about getting calories to people, but it's about making sure that people are actually getting quality, nutrient-dense food, right? It's not, not every calorie is created equal. That's why, their diet soda and diet products are frankenfoods, in my opinion, right? Matter can neither be created nor destroyed, right? But you're drinking something, so it says zero as if it has zero impact on your body. What's funny is that actually studies have shown that diet soda increases your risk more than regular soda for diabetes. And the reason for that is probably because it's an endocrine disruptor. It disrupts our hormonal balance, fooling and confusing our system, right? By basically giving us flavor in our mouth without actually getting the nutrients that come with that flavor, that are connected with that flavor. And I think, that's another aside that, another theory of mine is, that what I put together at some point in a book is this idea of like a flavor instinct, right? When you look at animals in the wild, right, they all have an instinct to know in their foraging what foods, are poisonous, what are not. And they also have an instinct for, okay, I need a bitter herb or a sweet herb, right? They kind of know what to crave. And when they're craving those flavors, right, that satisfies their cravings and their taste buds, that flavor doesn't have a nutrient, but it's connected with a nutrient. In nature, all these flavors, like for example, you have a tomato flavor, it's connected with lycopene, right? The berry flavor is connected with the anthocyanins that are in the berries, right? So we're craving the flavors and we're getting the nutrients. Unfortunately, because of gas chromatography in the 1960s, and Frito-Lay's was the one that started it, we started to separate out flavors from nutrients. And now if you go to the grocery store, right, convenience store, there's all these ads about flavors. Notice that they're always talking about all the flavors that to appeal to our cravings, right? Because we all have that fundamental craving for flavor, but none of the nutrients are there. So if you get that potato chip or whatever, that Dorito or whatever that is like bean flavored and tomato flavored, your body will be craving that and might enjoy it because your body wants the legumes and the fiber and the protein from the bean. And it wants the lycopene and the antioxidants from the tomato. But it's only getting the flavor, and it creates an endless cycle of craving which is never fulfilled or satisfied. And really sets us up for failure. And I think the food industry has done a really great job of hijacking our taste buds. The good news is that our taste buds change over in as little as 28 days. So in just 28 days, if you actually start eating real food, you'll notice a difference. I see this in patients that I kind of have them make a shift in their diet. If they have a sweet tooth, if they have a salt or savory tooth, that they're kind of craving those foods, and I push them towards naturally occurring healthy whole plant foods that have these nutrients, right? Like celery is higher than salt. There's more savory flavor to it, right? And so you're not adding salt, right? You're adding salt to taste. After 28 days, if you go back to one of those processed frankenfoods, you're just going to taste pure salt or pure sugar, and it's going to taste gross. You get desensitized to that, though, over time, and then your cravings are for these frankenfoods. So really going, again, back to agriculture and, the animal kingdom, kind of how all that connects in terms of like our own physiology and health. So there's definitely a big need for food as medicine interventions. And these are really categorized, the reason for it is, as I mentioned before, we look at how much we're spending on GDP and in healthcare, over 20%, 350,000 annual deaths. In comparison, if you look at it, nutrition-related costs are inexpensive medically. For the same cost as 1 day in the hospital, which is about $2,400, many food as medicine agencies can feed someone at home for 6 months. So you think about it, you either pay now and you eat the real food, or you pay later in the hospital. I'd rather pay now. I'd rather create a network of local farms, agriculture, connect them to clinics, and find ways to kind of make this concept fit together so that people are actually using food as medicine, right? Knowing where their food comes from. And let's pay for that, right? Let's pay for that. Thankfully, there was a big conference, as you know, a few years ago by the White House on hunger, nutrition, health, the first of its kind over 55 years. There's a big support, now $8.7 billion has been committed to the development of kind of like these programs. And they're kind of broad bases. If you haven't looked at this, it's good to look at, because they do talk about agriculture in this, and there's all these connections. So want to improve food access and affordability, integrate nutrition, health, and education, empower consumers to make and have access to healthy choices, support physical activity, and enhance nutrition and food security research. So obviously agriculture is a big part of that and connected to that, and this is something that's happening nationally with a lot of private and public partnerships. When we look at medical education, sadly, even though diet is the number one risk factor for premature disease and death worldwide and in this country, we only get an average of 19 hours of nutrition in medical education across all 4 years of medical school. So that is a huge disconnect, right? And you probably recognize that when you go to your doctor and you ask them what you should eat, whether or not you can eat something differently, or then actually make a difference rather than just getting a medication, right? Unfortunately, we don't have that in our education, right? So we're focused on fixing things once they're broken instead of trying to prevent that from happening in the first place and getting to the root causes. Culinary medicine is basically this field where we're combining the science of nutrition and medicine with the art of cooking, right? And cooking is what actually brings people's families together, right? And it's kind of a lost art where people are not doing it anymore. But it's really a way of bringing people together in a way that's really meaningful and powerful. This is an evidence-based approach where we can kind of combine these things together. And in fact, studies are showing that it actually improves confidence of health professional students, like medical students, in counseling patients about nutrition. And also it helps improve their own habits. We at the laboratory for the culinary medicine programs, right, is the teaching kitchen. Just like the anatomy lab may be the laboratory for learning about the body, so the kitchen is that laboratory, right? So we're actually translating a lot of this, and studies have shown that this hands-on learning by doing experience actually makes a big impact on those who participate in teaching kitchens. So, in my view, this should be a part of every health system, right? Where everyone is actually learning about how to use food as medicine. And there should be not only local gardens by the clinics, but we should also have direct ties to local community agriculture where that food comes in and is used in the kitchens, is prescribed in the clinics, right? Where people are actually using it to stay healthy. At the University of Arizona Culinary Medicine Initiative, it's a statewide, university-wide initiative. It includes the College of Medicine Phoenix, as well as the some of the other health sciences colleges and cooperative extension, and the libraries. And so, our goal with this is actually to create two things. One is to redesign the way medical students and healthcare professional students, including dietetic students, nursing students, pharmacy students, learn about nutrition, and using kind of this approach of using food as medicine and kind of learning how, in a hands-on way, how to use food as medicine, bringing chefs and farmers together, right, as part of this process, and also kind of doing it interprofessionally. So one of the programs, for example, that I've started here in Phoenix, in the College of Medicine Phoenix, is a Certificate of Distinction in Wellness, Integrated Medicine, and Nutrition. And as part of this Certificate of Distinction, students actually get credit for doing experiential and service learning activities in the community. So one of the community activities, for example, that we do is in the downtown Phoenix Farmers Market. We do monthly demonstrations, cooking demonstrations featuring local farms and ingredients. That morning we get there, we get ingredients, they give us market bucks, we put them together, and then we do a demonstration. We talk about nutrition and health right then and there. We also try to emphasize the Double Up Food Bucks program, right, that's available at farmers markets. We work with food banks to create, we're working with, for example, Desert Mission right now to create a digital library in food literacy on the foods that they're giving out to their to their community members, and showing how there's nutrition like benefits for these and how to connect those together, and kind of creating that library as well. So there's opportunities, and also we're working in school systems, right, to do some of this education and partnering with other groups like Blue Watermelon Project and others in the area. So I think there's a lot of opportunity here where you can actually engage in service learning with health professional students, where they can help to support this work that, really important work I think that Cooperative Extension is doing, and kind of bringing all these different folks together, including federally qualified health centers. In Yuma, we're working with one of the federally qualified health centers there and their dietitians, and also working with students, and also the Cooperative Extension offices with 4-H and things, and to engage youth in those communities, and also engage the medical students who are rotating there to also learn about food as medicine with their patients, but then also to kind of work with the local community that is, disproportionately impacted with diet-sensitive diseases like diabetes. So, the idea is really kind of this service learning approach, connecting those dots, doing research and looking for opportunities for partnership, I think, and connecting with farmers is a key part of that, and agriculture. The other thing we've done is also we've created an open educational resource, which we'll be releasing in culinary medicine. There'll be open access for everyone on education for culinary medicine for all health professional students, basically. And we'll have that as well. So I think agriculture is critical, and I'm going to be kind of winding down with some of my slides here, and I want to actually open it up a little bit more for discussion, questions, and obviously could hear from you, and because you have a lot of unique backgrounds, I'd love to hear a little bit more of your perspective. But I think this is where real food comes from, right? And I think that real food is really the real answer to a lot of the issues that we have right now. When we look at opportunities like regenerative agriculture, when we look at the impact it has on not only individual health, but also on, planetary health, right? In terms of carbon sequestration and all the things that go into it. It's interesting that we had to come full circle with all of our modern science just to realize that these, traditional indigenous practices were actually the things that would not only be the best for the planet, but also the best for us. If we weren't so arrogant, maybe it would be a better world. When we look at the benefits, we talk a little bit about organic versus conventional agriculture. I mean, you all know this more than I do, but the higher level of nutrients have been found in these. Higher level of antioxidants also are found. A lot of times, as a practical tip in terms of what to buy organic, I really refer to the Environmental Working Group, which has this whole idea of the Dirty Dozen and Clean 15, which I think is a really good description for patients and people to realize kind of on a budget kind of where to do that. And really, how soil health is, I think, critical to all of this. I'm going to briefly talk about the food as medicine interventions. These are basically the ones that we have now are medically tailored meals, medically tailored groceries, and produce prescriptions. And then obviously culinary medicine programs. The goal, we have this saying in healthcare, we want to do what's called the quadruple aim, which is basically we want to enhance the patient experience so people have like a positive experience when they see a physician, improve population or community health. We want to reduce costs, and we also want to improve the work life of healthcare workers, right? That's the quadruple aim, as opposed to the triple aim, which doesn't include the healthcare workers. I think that food as medicine interventions goes above and beyond even this, but can also address health equity, which I think is really unique as an intervention. Not only is it cost effective, but it can actually equalize the playing field if we're actually starting to reimburse for this. So medically tailored meals, you may have heard of this. This is basically having, up to 10 meals or more a week that are delivered for people who have really severe advanced disease, right? That could be cancer patients, that could be people with heart failure, people who are otherwise homebound because of illness and disease. And, we have actually the most data for this. And this is the way it works as a food as medicine intervention. All of these are reimbursed by insurance. So there's a number of states, about 11 now in the country, that have what are called 1115 waivers by Medicaid to allow for reimbursement of this by Medicaid and Medicare. Unfortunately, Arizona is not one of those states yet. California is, and they're seeing a lot of success with this. This is something that we should be advocating for, and we're hoping that eventually, as the data comes in to support these interventions in terms of their impact on health, we see this expanding to a national policy, right? And then once Medicare and Medicaid go to say that something is reimbursed, then all the private payers usually follow suit. So what's the evidence for medically tailored meals? This is actually the one that has the most evidence behind it. So basically we've seen in diabetes patients and prediabetes, drops in hemoglobin A1C, drops in weight, drops in blood pressure, improvement in preterm birth. There was a big modeling study that showed, really high cost savings, reduction in hospitalizations, and hundreds of millions of dollars of healthcare costs and unnecessary hospitalizations just by having medically tailored meals prescribed and given to the people who qualify for it right now. So this is really a way of not only saving money, but actually improving lives right now by using the real food that comes out of the ground as a treatment. Another food as medicine intervention is produce prescription programs. Produce prescription programs are basically getting people who are food insecure access to fresh produce, and they may have diet sensitive conditions like diabetes, where those produce prescriptions can go the next step of also giving some guidelines on recipes, right? Especially if you add the culinary medicine component, some cooking demonstrations so people know hands-on what to do with that food and how that can be used to treat their conditions. Produce prescription programs have been associated with improvements in fruit and vegetable consumption, food security, health status for both adults and children. Again, also improvements in hemoglobin A1C for pre-diabetic and diabetic patients, decrease in blood pressure, decrease in weight, improvement in cardiometabolic health. If you implemented produce prescriptions among US adults with diabetes and food insecurity, you would generate substantial health gains, and this would be highly cost effective, right? So this is really, we could also, avert and prevent over 292,000 cardiovascular events just by giving fresh produce to people, right? So switching from a pharmacy, PHR, to a pharmacy, FAR, right? That can make a big difference. And so these are, and medically tailored groceries are also emerging as another thing. We don't have as much data behind that, but it's really interesting how one of the people that organizations or groups that you would not think would be engaged, but are life insurance companies. So life insurance companies want you to live a long and healthy life, right? Because they don't want you to die prematurely and they have to give their payout, right? So they've actually started doing medically tailored groceries. One of the big ones, John Hancock, actually now has thousands of their members, connected with thousands of grocery stores across the country, where they're actually subsidizing groceries and fresh produce for their members because they know that that's actually going to help keep them healthy. So it's about finding ways to align incentives to make it a win-win scenario for everyone involved, right? And that's why it's really important to connect these dots together, because we only can do this if we're working on it collectively. So yeah, that was about that. And so, we have to evaluate the outcomes. We have to look at, what are the food-related risks, what are the patient outcomes, what are the healthcare costs, what are the risk factors that we can connect. I think some of the questions are which population should be a focus, how should we bring this into medical education and training, how can this connect clinical care, a lot of questions, right? But I think these are questions that we need to start asking ourselves. Just another data point is the Food is Medicine Collaborative. It's a national collaborative, basically of over 20 organizations, including community clinics. They've found that food pharmacies, patients who participated, 92% have adopted healthier eating habits, 93% feel more sense of community, 83% are more likely to seek medical care at the clinics, right? And so the preliminary evaluation also shows all these benefits in terms of blood pressures and weight as well. So we're starting to aggregate this data nationally right now, and it's starting to really kind of gather steam. So I think it's an exciting time, and I think that, again, our agriculture should be at the heart of this discussion, because where does the real food come from, right? And that's why we have to kind of be mindful of this and kind of all hands on deck. So I will pause there and open up to questions and have any points of discussion. Thank you again for your time. Yes, go ahead.
So I'm curious, where do you draw the line between real food and Franken-food? Because, like, for instance, I have a recipe for chicken salad, and I have a recipe for hummus, and they're exactly the same ingredients, except this one goes in a blender. So where do we put the dividing line?
Yeah, it's a great question. Yeah, so what's the dividing line between real food and not real? I think blending your food does not make it a processed food.
Okay.
So I think it's more, where does the food come from and how is it processed before it gets to you?
Okay.
If you're using whole ingredients, right, that have been minimally refined before it gets to you, then it's not a processed food. Right? And so one way to look at it is a lot of prepackaged foods are processed foods, right? If the package has more than, 3 to 5 understandable ingredients, then it's more likely to be a processed food. If it's an ingredient that you can't pronounce or understand, then it's not really food. So I think those are some of the general rules to look at. And in general, eating unrefined whole food and whole food ingredients, just like you described, are the case. And then it gets a little bit more nuanced when we look at oils and fats, unfortunately, because they're processed before they come to us, right? And so now I've generally shifted to really just recommending people use, kind of extra virgin olive oil or avocado oil or butter that's grass-fed, again, because of the farming that goes behind that as well, rather than a lot of the seed oils, because they're really more like, the term vegetable oil is really a misnomer. It's really more accurately, it's like industrialized waste product. It's not really vegetable oil, right? You should be eating vegetables, right? And real healthy fats from nuts and seeds and, avocados and things like that, right? But the vegetable oil is not really a source of vegetables. So that's a processed food, for example. Yeah, if that makes sense. Yes, go ahead, sir. You had a question?
Yeah, I was just, I'm from the Hopi Indian Reservation. I'm an assistant professor here at the University of Arizona, but I'm also a farmer. I've been raising nutrient-dense foods for over 3,000 years.
That's awesome.
And I'm part of a study looking at the Periodic Food Table Initiative that the Rockefeller Foundation and the American Heart Association is looking at.
Oh, yeah.
But what I'm concerned about is mostly, we have, of course, here in the Gila River, we have the highest diabetic rate in the globe. And then when I look at like this survey that I have a colleague on, this National Health and Nutritional Examination Surveys, it doesn't even go out and look at native populations, which for me I can't understand why.
Yeah.
And because last time I heard, because they said our population is too small, but there's a reason why it's too small, because of the foods that we're eating and given by federal programs like USDA and things like that. And it seems to me like the University of Arizona, I'm doing a needs analysis here in southern Arizona. I've been one of the Pueblo tribes. The need's there, but how do we focus that policy going from looking at Indians as being some sort of romantic vision to one of like, well, they need help too.
Yeah.
I mean, that's always been a problem with the Indian American relationship. It's kind of like we're different. Our bodies are different. We observe different things. The foods that we were eating were really healthy for us. Now the foods we're given just give us these high things, what you were just talking about. So it's kind of a policy problem. You probably won't be able to answer it that well, but my thing is we need to start looking at some of those critical areas and have an equity, and fill up the equity gap that exists right now.
Absolutely, and I'd love to connect with you afterwards to see how we can collaborate. I think,
Okay.
Engaging the tribal communities is really critical, and it's also like an area of opportunity that we haven't tapped.
Yeah, exactly.
I've talked to Gila River, for example, and what's interesting with them, they have these clinics, right, with healthy lifestyle centers and like even like a kitchen, I think, as well. But like they don't have, they are a food desert. Like their community's a food desert,
They're
right?
not producing those.
They're not producing, right? And so what's our answer to that, right? How can we bring the produce there? How can we actually help to make it sustainable there in the community there, right? We don't want them to just kind of bring produce from somewhere else, right? That's just a quick fix. But how do we do it for long term? And I'd really be interested in
Yeah, we can talk about
talk about that, because I think it's really important. We've started to partner with Native Health, which is a federally qualified health center in the area serving a number of tribal communities. They do some cool, innovative things around nutrition and health. We started working with them on, we're developing a diabetes food pantry. We're helping with their kind of videos on, indigenous food ingredients and kind of calling out the nutrition benefits, and also hosting a monthly dinner with an indigenous chef every month, kind of featuring those ingredients to just kind of continue to build that sense of community. But it's really important, I think, to realize that there's a lot of richness and cultural traditions like that have really gotten pushed to the wayside, and like you said, you don't want to romanticize it, but at the same time you want to recognize the fact that there's a real need there, but there's also a lot that can actually be drawn from traditional practices that is not being drawn, right? I think there's a book that was there's a couple wrote about like the 7 circles of healing. I don't know if you've read that as well. That's a local couple that kind of from different tribal nations talking about that. And so my role as a physician who practices integrative medicine, I trained with Dr. Weil, and we kind of looked at this whole approach of like, I feel like that really should be a part of that, right? We should engage with those indigenous practices and healing traditions and bring that into our approach to healthcare. And I think food is a big part of it. So yeah, I look forward to having that conversation with you. Thank you. Other thoughts, questions? Yes?
Talk a little bit about herbs. This is a fantastic it's a lot about policy and obstacles and things like that. But if you have a background in it, I'm very curious about herbs, the anti-inflammatory, anti-cancer, and just generally speaking, I'm really interested in that. Not necessarily medicinal herbs, which is kind of a term that a lot of people kind of throw around. It's maybe too broad.
Sure.
But either fresh or dried or the root or whatever.
Yeah.
Share what you can with that.
Sure.
And how can we as farmers increase the slice of the pie in our decision making, what we grow.
Yeah.
Offer people not only our fruits and veg, but the fresh herbs and dry herbs to consume as medicine.
Yeah, fresh herbs are really key part culturally. We call that sabzi or greens in our culture, and we always have like a variety of fresh herbs on the dinner table. Including things like mint, basil, a number of the different kind of herbs. Sometimes I don't remember the English name because I know as growing up Persian. Yeah, what's it? Yeah. Coriander, parsley, thyme, oregano, right? A lot of these, and they do have, as you said, like medicinal properties, like antiviral, antibiotic properties. They help with digestion. Garlic is another one, right? Onions is another one, right? Studies have shown just like garlic is really very a very powerful, potent, I would say, food that's been around for a long time. During the time of the bubonic plague, right? People talked about wearing necklaces of garlic to ward off vampires, which they thought was the cause of that. But what's interesting is that it was actually the plague. It was a bacterial infection, and garlics are antibacterial, right? And so actually consuming, there was that connection that we probably didn't see as much. But garlic, again, in its unrefined fresh state is really important, right? Because it actually is like, I use an analogy of like a glow stick, right? There's 2 precursor enzymes for allicin, which is diallyl disulfide, and those sulfur heads are what gives it that pungent smell, right? And they're actually kind of together in the intact garlic, but when you crush the garlic, the two precursors come together, and then allicin, this diallyl disulfide, is formed. It's very volatile. Actually only lasts for like 20-25 minutes. And so actually eating that raw, fresh garlic is actually a really great way to get a lot. And that's been shown to be antibacterial, antiviral, antibacterial, both gram-positive, gram-negative bacteria, antifungal, antiparasitic. So it has a lot of different benefits. I think that one of the challenges, also people don't realize that a lot of the medications we have, right, originally came from plants. And ethnobotany was a big, this piece of it, unfortunately, used to be part of pharmacology training, is to actually learn where the plants come from and how they lead to and they've eliminated that in a lot of pharmacy schools, which we unfortunately don't see that anymore, but that's really where the root is. And so there's a lot of opportunities, right? There's still some companies that are, deep in the Amazon trying to search for the next, right, breakthrough like herb that's going to give the breakthrough drug that they can patent. I think unfortunately, because of the way healthcare is, we don't look at herbs, as other than kind of like, edible weeds, unfortunately, like, right? And I think part of that, what's that? Or teas, but we don't even look at teas and tinctures as medicinal, right? Like oil of oregano, for example, is like really powerful antiparasitic, antiviral. I have patients who, the first sign of illness kind of take a little bit of that and they don't get sick, right? It really can knock out a lot of things, and there's studies behind that. But we don't think about it that way, right? We don't have herbology as part of, our approach to healthcare. So I think part of what needs to happen is we need to recognize their value and incorporate that into our daily life and our daily diet. Cultivating herbs, having a little backyard herb garden, so that there's more understanding of the benefits of it, and for people to engage in it, and then for farmers to be able to produce it, right? Because again, if there's not a demand, right, want to ask farmers to produce something where no one's going to actually utilize it.
Well,
So,
we're growing a lot of herbs, but food banks are prohibited from purchasing them.
which doesn't make any
Because it's not
sense.
food.
It's ridiculous.
And the same thing goes for like roselle, which I grow a lot of. If it's under the category of tea versus food, they cannot buy it.
Wow.
So
So-
there's a huge, there's
So
a
what
lot
can?
of
That's a
obstacles.
policy issue then that needs to be
Yeah.
addressed.
Yeah, you can work on it.
Well, yeah, we would love to learn more about that and figure out what we got to do. Yeah, that's really important. Thank you. Yes.
So for the medically tailored meals that you're talking about, and you
Yeah.
mentioned that may not be happening here in Arizona, or if I misunderstood, I apologize, but for that program, are the different entities that are implementing it using local farms or local produce to then
Yes.
maybe work with a local company to deliver
Yes.
them?
Yep. Exactly. That's what they're doing. When I say that it not be done in Arizona, there may be groups that are doing something similar. There's one group here in Phoenix called Joy Bus Center, which they actually do these types of meals for cancer patients, and they deliver them to cancer patients every week, and they're going to be scaling that. Right now, insurance is not reimbursing you for it in Arizona because we don't have the 1115 waiver from Medicare and Medicaid to do that. We're hoping, and eventually I think that's going to become something that's going to become more of a national policy because of the impact it obviously has on health outcomes. And so it's really important now to begin to build that infrastructure in anticipation of that, and to engage healthcare systems and farmers to kind of work collaboratively on that. Yes.
Do you have information about food-based medicine for allergies problem?
Sure, food medicine allergy. There's a lot of different options there. I mean, there's some herbs like stinging nettle, which have been shown to be effective in relieving allergy symptoms. Quercetin, which is found in apples and onions, also has a strong anti-inflammatory effect, which also helps with allergies. Studies have also shown that consuming local bee pollen and local honey can also help to desensitize to certain allergens and the pollens that are connected with that honey. So that also is another area that can be useful. I think in general, reducing inflammation in the body by avoiding processed foods and having more anti-inflammatory foods in the diet, like leafy greens, berries, certain spices like turmeric, ginger, garlic. All of these I think are really helpful in those situations. Other questions or thoughts? It sounds like, yes, please.
How how important does protein play in this? Because we talked about type 2 diabetes and fiber playing a role, but being diabetic myself, one trick a nurse taught me was 40 grams of protein helps regulate your blood sugar for hours.
Yeah, so the best thing that I've seen works is actually a combination of whole grains or healthy carbs like non-starchy vegetables with healthy fats. So protein is one part of it, but I think healthy fat actually helps a lot, specifically monounsaturated fat, like extra virgin olive oil, avocados. It's also found in almonds and pecans and dark chocolate, as long as sugar is not a big ingredient. It's 60% or more cocoa content. What happens is that in these healthy fats, it actually increases our body's sensitivity to insulin. So it helps to reverse insulin resistance. And when you combine it with healthy carbs, for example, let's say I'm having brown rice with extra virgin olive oil, or I'm having whole grain, like Ezekiel sprouted grain bread, or whole grain bread with avocado, like an avocado toast with like nuts and seeds and olive oil, the combination of the healthy fat and the healthy protein with the whole grain carb and the fiber, all those together lower they slow down the absorption of blood sugar, so they basically, you don't get a big bump, but you get a gradual release. So it's kind of like a combination diet, and that's what I've seen to be the most effective. Yeah.
How about fat from grass-fed meat?
Yeah, so fat from grass-fed meat is better than fat from conventionally produced meat. It has a higher omega-3 and HDL content as well, and so that is all good stuff because those are both anti-inflammatory and helpful in terms of preventing heart attacks and stroke and reducing inflammation. I still think that when you look at places like blue zones where people are long-lived and living healthy lives, the amount of meat that they eat is like the size of a deck of cards 4 or 5 times a month. So it's a very small amount. It's not like an excessive amount. I think that's where the balance needs to come in. I definitely say that if someone is going to eat meat, that it should be grass-fed, from regenerative, farming sources, especially also with like dairy products as well, because you also avoid the pesticides and hormones and all sorts of other things that go into, when they do corn, over, half a century ago, they would only give corn and grain to cattle to fatten them during the last few weeks before slaughter, because they knew that the cows would be unhealthy otherwise, right? They wouldn't do it their whole lives. And now it's really funny for me to see how certain purveyors of these foods and restaurants even say 100% grain-fed beef. Like, why would I want grain-fed beef? Like, that these cows are sick, they're not well, and they get overly, obese, they get all the chronic diseases that we have, right? And then we're eating them. So I definitely think that grass-fed is the way to go, and right now that also supports more local, smaller scale farms, so it's not mass-produced. Interesting enough, if you eat lamb in this country, most of it either comes from New Zealand or Australia, and even the local ones, they all are grass-fed by default, because no one's really mass-producing lamb. And the places where they produce lamb, they're doing the sustainable kind of agriculture that they do. So that's another option, looking at red meat. You're going to get more grass-fed. Other questions or thoughts? So thank you very much for your time.